Hello, everybody. I'm Lindsay. I work in IHPS in the Communications Committee, and today I am joined by Monisha Bhatia, who is also in IHPS. So exciting. She is an assistant clinical professor in the School of Medicine and a hospitalist here at UCSF. Her research focuses on patient communication, care documentation, implementation science, as well as public health care information, and disinformation. So that's a lot. I'm so curious, Monisha, what are you working on right now?
Well, currently, I've been spending a lot of time getting ready for our grant-funded project to study how we can launch a discharge team at UCSF Health. Within the Division of Hospital Medicine, we have an internal grant program, and I was delighted to receive this to work towards creating a discharge team model. Often in health services research, we are thinking about how do we create models of care that can be scaled to other systems and to solve widespread problems. At our health system, like many other places, there are so many people waiting for hospital beds in the emergency department, and a commonly cited barrier is whether there's patients upstairs who can actually just leave the hospital soon. So a discharge team aims to solve that problem, but there's a lot of thorny issues that have to be also addressed in the meantime. Top of mind for many of my colleagues in hospital medicine is how can I protect myself, or what are the safety issues with trying to let a patient leave, or also signing out that care to another attending. So I think that it's a really rich topic, and I get a lot of energy whenever I talk about it with my hospital medicine friends, and also even friends who have all been patients in hospitals and struggled with the same issues. So excited to kind of do this cross-cutting work.
Yeah, I mean, I'm sure for you, you have this dual perspective as, a doctor, a hospitalist, and then also we're all patients in our own way. So I can see how this would really be a super interesting and important personal area of research. I'm curious how you kind of landed on this subject and what encouraged you to pursue the discharge team format. That's something I've never really heard of. I'd love to hear more about it.
Sure, yeah. I think it intersects with a couple of different areas of interest of mine. Before I went to medical school, I went to law school, and so I'm always interested in healthcare regulation and also how people feel about malpractice, which feels very top of mind for many people who are practicing in medicine these days. So discharging a patient from the hospital feels very fraught with risk. One, because it poses actual risk, of course, to the patient if they're being discharged too soon or without the appropriate follow-up or other tests. And then sometimes it's also a matter of feeling that professional sense of fulfillment by taking care of a patient well. I know that burnout is a very common topic among many researchers these days because it's challenging to study and it's also challenging to solve. But just discharging a patient from the hospital also feels very fraught with stress because of those pressures, not just from a litigation standpoint, but also because of possible harm that could come to the patient and a lot of pressure to do it just perfectly. So it's hopefully something that can address multiple issues. I mean, what maybe emergency department boarding is top of mind for some folks, but also for many individuals, feeling more emotionally fulfilled by our work is important. And so that's something that's really been motivating me these days. It's seeing that intersection between what we require people to do and what we really think is actually best for the system long term.
Yeah, absolutely. I'm also curious to hear for that patient dialogue from your personal experience, are like patients typically understanding of the discharge schedule? Is there pushback? How has your personal experience as a practitioner kind of inspired or informed your understanding of this topic?
Yeah, I think on my list of topics of interest is patient communication. And I feel like
Right.
the other reason why I love discharge as a topic is because it involves so many of those core fundamentals, both from clinical practice as well from when we think about it from a systems perspective. How do we communicate with patients and what do they expect from us? And how do those expectations align us for success or sometimes failure? When we communicate with patients as they're leaving from the hospital, it's obviously multimodal, and many patients, they rely more on their phones these days for communication about healthcare, whether that's their follow-up appointments or even getting information from people. Some people may be calling them, even though they're in the hospital and they could be visited at the bedside by some clinicians. It's easier to call them in some cases. So, seeing that patient experience angle of like, how do I expect my hospital team to communicate with me? How does that align with, my expectations of being a patient outside of a hospital too? many cancer patients, for example, are so accustomed to messaging their teams on MyChart, which is the clinical application that we use to interface within Epic with outpatients. And it's really interesting to see how that lands in an inpatient setting because many patients have high expectations of people communicating with them, but we don't always meet those. And that sometimes lands us up for miscommunication and failures in reaching diagnosis in some case because they don't necessarily trust us. We don't communicate the same way that their trusted care providers do. So I think that it's a really rich topic in and of itself. I have tried to apply for some grants to look at that, and that's hopefully something that will be coming in the pipeline one day. But I'd like to really study that in detail. It's how do we communicate effectively and in a way that builds us up towards successes rather than failures.
Yes, that is so fascinating, particularly your point about how much we rely on smartphones these days. I can speak for myself, it's how I do all of my healthcare related, ordering prescriptions, making appointments, and I can only imagine, right, when you're in the hospital, how that changes the way you relate to the people who are actually providing you care. That is such an interesting angle. I personally never considered it before. Um, and so, of course, it sounds like this research is going to do a lot to help patients receive better care and also just feel, as you were saying, that deeper trust and connection with the team that they're relying on. In a broader sense, I suppose, how would you hope that your work can help change healthcare and health policy, if that's something on your radar?
Yeah, I do think that some of what we pursue at individual centers like our own, even though it's really big, it's certainly not all academic medical centers, but we do have all sorts of different ways of approaching the same problem. And I wish that there was more information sharing. Something that I haven't worked on directly, but would like to, is how do we sort of scale some of our monitoring efforts for not only bad outcomes, but good outcomes. I'm part of an effort called Achieving Diagnostic Excellence through Preventive Teamwork. And the ADEPT program works across multiple medical centers to try to study the issue of diagnostic excellence. And one of the express goals of this program is to try to design a framework for monitoring this type of not just errors or diagnostic error, which also starts with an E, unfortunately, but also diagnostic excellence. So looking for ways to actually reach diagnoses and help patients on a broader scale. Some of that would also entail working with federal regulatory agencies to design a framework to study and monitor and report that type of data on a national scale. So it's really exciting work because this problem hasn't been sort of well articulated yet in terms of a measure or a metric that can be reported across hospitals that feels authentic and reliable to the people who are working on it. So I think that's a really exciting example of, taking these really granular problems within the healthcare setting and trying to set up something much larger than ourselves, which I think is really cool.
Yeah, absolutely. And I can only imagine how different this condition is or this situation is in different places across the country. In San Francisco, especially at UCSF, the circumstances I'm sure will look much different than somewhere else in the nation. So I think that could be really exciting, once you're able to look at that sort of more widespread view. And this is a very sort of nebulous, abstract question, but I'm curious, you have this really exciting research. What's next? That could be in terms of this project or future goals, future interests, something else you may want to speak on. I'd just love to hear what your plans are.
Yeah, I was mentioning hoping to study some things that I've submitted grants for. One other thing that I'm looking to break into is looking at how sustainability functions in the healthcare space. And within the inpatient setting, which is where I'm focused primarily, I think there could be more attention paid to plastic waste. This is another problem that can be really hard to study. Because even when we talk about, oh, just within a hospital, how much plastic waste do we use? There's a lack of standardization across the different clinical spaces, and many of the different sort of units within a hospital may have differing levels of leadership and independence. It's just very challenging, I think, to really get a grasp of the problem of plastic waste within healthcare settings on the inpatient side. So that's one area where I'm really hoping we can add some evidence to the discussion. There's been so much exciting work from emergency departments, from individual clinic settings, but this is another really challenging problem to solve from the bottom up. And so I'm hoping that we can hopefully give leadership some data to understand how we end up using plastic wastefully in the healthcare setting. But it's admittedly like well out of my comfort zone, even though I have listed all these things that I'm interested in. That's one of these creative spaces that I'm hoping I can partner with others and really understand that problem better.
Yes, that's huge. Speaking as somebody who worked in the wet lab in academics and also in R&D, the waste is it made me very uncomfortable, to be honest. So I'm really excited to hear you express some, desire to to actually look into that problem. Um, well, Monisha, thank you so much for sharing information about your current plans, what you're planning to work on in the future. It's really exciting to hear about, and we're all rooting for you here in your UCSF community. Thank you so much for your time. It was a delight talking to you.
Thanks so much, Lindsay. I really like talking to you too.